Hi, I'm Dr. Joshua Huffman. I'm a board-certified chiropractic neurologist through the American Chiropractic Neurology Board, and I'm a diplomate of the American Board of Anti-Aging Health Practitioners. I'm also a certified functional medicine practitioner through FMU, and I'm the author of the book Growing Young. I own and operate a private practice in Mounds View, Minnesota called Mounds View Chiropractic, and have been open there since 2007. So one of the things that our practice focuses in on is working with kids that have autism spectrum disorders, ADHD, ADD, dyslexia, and working to really help naturally change the way that the brain is balanced and the brain is developing. And so if you're watching this video, you likely have somebody that you love and care about that's struggling with symptoms of anxiety or anger or impulsivity or hyperactivity or just problems focusing in the classroom. And there are natural things we can do to really help support the development of the brain and help make permanent change in the way that these kids are performing in life. And so I want to share with you some of the strategies that we use in our office. So when we're looking at a child's brain, obviously things are changing rapidly as the brain is developing and aging. And so two things you have to take into account when you're working with a developing brain is you have to look at, is the brain getting the fuel that it needs to thrive? And number two, is it getting the stimulation and the activation that it needs? And so with all of our kids that we work with in our office, we do a full neurologic assessment where we go through and we test each individual region of the brain to see what parts of the brain are doing their job really, really well and what parts of the brain may be developing at a slower pace. And if there are imbalances in certain regions of the brain that aren't keeping up with the other regions, these imbalances create a disconnection between the regions of the brain where the brain can't talk back and forth, and this can create symptoms. One of the most common areas to be impacted from a functional standpoint in brain development for kids, especially kids that are suffering with ADHD type symptoms, are the frontal lobes of the brain. The frontal lobes of the brain help regulate your emotion, they help regulate your impulses, they help regulate your focus. And so you can see if the frontal lobes are not firing on all cylinders, it could definitely create many of these types of classic ADHD type symptoms. So we want to go through and test each area of the brain. We look at the way the eyes move, we look at the way the eyes track, we look at the coordination of movement in the child, we look at their balance, we look at their spinal health. We go through and do a complete neurologic assessment to create a full picture of imbalances that have developed in the brain. In addition to looking at just the brain balance and how that's impacting performance, we also want to look at the body's chemistry when we want to see, is this child getting the fuel that they need to the brain? So are they delivering oxygen to the brain efficiently? Are their blood sugar levels regulated throughout the day? Are there any inflammatory mechanisms going on within their body that could be creating inflammation in the brain? You can have chronic infections in the gut. You can have reactivities to foods. You can have allergies that are stimulating an immune response that create inflammation in the brain. And so looking at gut health, looking at immune health, looking at hormonal balance, looking at neurotransmitter balance like serotonin levels, dopamine levels, how their bodies clear out serotonin and dopamine. These are all things that are important to decipher in order to really get a clear picture of how to best support each individual child. And so these are strategies that we use in our office to do this. We do a 2-day intake process in our office when we're working with children. We have them come in, we go through a full case history with the parents, and then we go through and do the functional neurologic evaluation where we're going to go through and test these different regions of the brain. Parents are able to see exactly what's going on as well. So I try to show parents as we go through the process of the exam exactly what's happening, so you can see for yourself the areas in the brain that may be struggling to perform. We go through and do a full spinal exam as well. Again, when the brain is out of balance, that can cause postural alterations where we may have poor posture, we may have more slouching. We also may develop scoliosis. So we look at spinal health in tandem with the brain health. And then we have a follow-up visit with you guys where we do a full review of everything that's going on in the body, in the brain, and we talk about lab testing that would be most appropriate based on the symptoms that the child is having to help evaluate, are they getting that fuel delivery to the brain? or are there any inflammatory mechanisms that are hindering brain health as well? So we bring those two pieces together. One other great technology that we use in our office to help further assess brain performance is what's called QEEG. QEEG is a form of evaluation where we place electrodes across the scalp of the head, and it reads brainwave activity. And from that, we can develop a report that shows imbalances again in brainwave activity within the brain. So we can see from this QEEG if there are imbalances in the frontal lobes of the brain. And it gives you a clear-cut report that shows, and that we can retest and objectively measure changes that are occurring in the brain. So the QEEG is also a super valuable tool. And so once we've identified these areas that are out of balance in the brain, we develop a specific rehab protocol to basically exercise these areas of the brain and start targeting the specific areas that are not working as efficiently as they should, and exercise those areas so they get stronger. As these areas in the brain that are lagging behind catch up, the brain becomes more balanced, and the kids tend to start to do better at focusing, at impulse regulation, regulating emotion. And so we start seeing changes like this, and it can really happen very quickly. So these are some of the strategies that we use in our office to help kids. I hope this video is helpful. Check out our website, browse through our website. I have a lot of information on there. With all of our kids, and with parents and grandparents of kids, we offer a free phone consultation where I can get on the phone with you and answer more questions specific to your kids. So you just register on our website, and we will get in contact with you. We'll schedule a time where I can sit down and for 5 minutes just discuss your child's case and let you know if this would be a good fit. And you can also kind of interview me and see if I'd be a good fit for you. And so we go through that process and see if this might be something that would be of benefit for you. And then from there, we move forward however you like. So if you're interested in getting that set up, just register on our website. We will get in contact with you, and we'll schedule a time to sit down and talk and strategize about how to best help your child thrive. So I hope this video is helpful. Thanks so much for your time, and God bless.